To the public healthcare system now, as an increasing number of Canadians are finding themselves without any form of primary care. Back in 2022, StatsCan estimated that 14% of Canadians do not have access to a regular healthcare provider. Another survey in that same year from the Our Care project led by the University of Toronto suggested the numbers were even worse, with 22% not having that primary care. And the picture does not seem to be getting any better, with medical students being less likely to choose family medicine as their career path. To talk about this, Primetime Politics host Michael Serapio spoke with Dr. Danielle Martin. She is the chair of the Department of Family and Community Medicine at the University of Toronto's Temerty Faculty of Medicine. Dr. Martin, good to see you again. Thank you for joining us.
Good to see you too. Thank you.
Now, according to the Canadian Institute for Health Information, family doctors make an average of $299,000 a year in this country, so very well paid. Why are med school students shying away from family medicine?
Well, it's a complex thing, and I think, the numbers can be interpreted in different ways, but I think the bottom line is that we do have to make sure that medical students are excited about the possibility of a career in family medicine. I've been a family doc for almost 20 years now, and I wouldn't make a different choice. I love my job. But of course, there's more than being well paid to make people have satisfaction in their job. And one of the things that we do know is that as the healthcare system has struggled in the post-pandemic world to meet needs, a lot of the burden of trying to help our patients navigate healthcare systems has been falling on family docs. And so how does that show up? It shows up as a increasing administrative burden, more time trying to navigate, trying to get access to services for patients. The complexity of people's illness is rising as the population ages and people have more chronic diseases. It's becoming a harder job. And of course, just as inflation has hit every sector of the economy, those family docs out there that are running a small business are experiencing costs at a higher level. And all of that gets transmitted to our learners. So there are things we can do in education to make people more excited about a career in family medicine. But there are also things we need to do to fix the health system, make it a job that is joyful and that brings meaning to people's careers. And our students are looking for signals that they can have a long and happy and fulfilling career as family doctors, and we're not yet delivering enough of those signals to them.
Mm-hmm. Well, I know the Ontario Medical Association, which of course is the province that we're in right now, they do suggest that the province adopt a number of different measures, like creating a centralized intake and referral system, using AI to take patient notes, which I know there's a pilot project on that right now, reducing the number of sick notes and referral letters. I'm wondering, if you talk about the administration and the difficulties of running a business, essentially for family doctors as a challenge, does it require a central government agency or some type of computer interface that provinces would administer instead of doctors to remove that away from what they have to deal with?
Well, we know that our learners overwhelmingly tell us that they are less interested in running a small business and more interested in focusing their efforts and their energy on practicing medicine. But I don't think that we can say that every doctor in Canada, every family doctor would just sort of hand over their business to the government. I don't think that that's a likely outcome. And so what we know our new grads are looking for and what the models that we want to be building going forward for people graduating are, I think, going to be less about that kind of entrepreneurship and more about the ability to walk in to a clinic that is well set up, that is well run, where you have a team, and that's really important. I mean, if you think about, you walk into a hospital, the surgeons are not, paying the nurses out of pocket, out of their billings. They're not hiring the dietitians and the social workers. They're not choosing the computer system. That infrastructure exists in hospitals, and we need to be building it in the community to support family doctors and other primary care providers, clinicians, to do their jobs. And so thinking about what does that infrastructure look like, that would be attractive to a new graduate. We know that our new grads are increasingly women who may take parental leave. We know that our new generation wants to have some level of balance in their lives. I mean, so do all the generations, actually. And so thinking about the capacity to hand over your practice to somebody for a period of time because you're having a child, and then being able to come back and know that your patients have been taken care of, and to be able to work in that team environment where there's a pharmacist I can consult on a difficult medication question, or a social worker who can do psychotherapy for my teen patient who's having a mental health crisis. Those are the things that we need to build. And I don't think it's about government taking over. It's about building models that, yes, are publicly funded so that all of our patients can have access to them, that will support family docs to do a good job for our patients. And knowing that you have a team and an infrastructure around you is part of what makes people feel secure. And people want security when they're making a lifelong career choice. So all of those things can matter.
And sorry to jump in there, but I appreciate what you're saying. Not every doctor in the country may be eager to surrender what has been a private business. But is that? It seems to be what you're suggesting is almost the model going forward, that perhaps, for example, because I know it's been floated, doctors become an employee of the province and get a salary rather than billing per patient. Is that the type of model? It's future casting rather than trying to deal with what currently exists?
I'm not sure that doctors would become employees of the province. We don't have that model in hospitals now, but certainly we do have models that exist in primary care, like community health centers, where doctors are employed by the health center and they're salaried and they have a pension and they have paid vacation and all of those things, and they work in a team. And there are also other models that we can be looking to. So, a doctor doesn't necessarily have to be fully employed and salaried, but can be working in a team-based model where they're drawing a steady income. There are lots of different ways to set it up that gives them some stability and allows that infrastructure piece to be taken care of. So I think it's I'm not sure that the provincial and territorial governments are going to want to get in the business of employing doctors either, but I do think that we can be doing something closer to stability for our new graduates, and there are lots of different ways to structure that would be potentially attractive to a new grad who's not interested in running a business. Ultimately, I think it's less about, is it an employment model and a salary model, and more about, is it a model that gives people some predictability of income, some predictability of support, so that they can come in and out in those early career years when people are building a family, knowing that their practice will be taken care of. And that team, I cannot emphasize enough how important that team is, both a team of medical colleagues who can cover you so you can take a vacation or whatever it is, and also a team of interprofessional colleagues who can help you to manage what is an increasingly complex job. I mean, when we look at the seniors who we take care of in our family practices today, it's not uncommon for people to, need 3 or 4 different specialists. You're trying to coordinate and quarterback that care. They've got 12 medications. Some of them are homebound. They need a lot of support, and we, as family docs, want to give that support. It's an honor and a pleasure to do this job, but to do it alone, without any backup or support around you, is not a credible model.
Dr. Danielle Martin, we could go on this, but I do want to thank you for the time. Really appreciate the insight.
Thanks for having me.